Hello, I'm Tanya Atagi, and thank you so much for joining me today. I'd like to talk a little bit about breast lifts and breast reductions. So this is a very common procedure in plastic surgery, and oftentimes when we're talking particularly about breast reductions, patients are really coming in because they are suffering. And whether you're young, in your or late teens or early 20s, or whether you're a little bit older, it really can become a burden to carry your breasts around. And oftentimes we're finding patients coming in where they just have been thinking about it for many, many years and really just are so frustrated and can't take it anymore. And so it is a procedure where it can help just be liberating. And so if you imagine putting a yoke around your neck with weight, however little or great it is, and getting up in the morning and going and doing your activities all day, it can be very burdensome, and it's tough, particularly when it limits your activities. And so I would say that our breast lift and reduction patients are oftentimes our happiest patients, and common comments are, I don't really know why I waited so long to do it. But also you can imagine with age, I mean, maybe when we're younger, our musculoskeletal systems are just more resilient, that we're able to tolerate that weight and whatnot a bit easier. But generally speaking, having that fullness in the bust line really can just become more laborious with time. And so the procedure itself, we do it under a general anesthetic with you asleep. And we like to have you bring in your wish photographs for us, because I feel that that minimizes any risk of miscommunication between what you're looking for and what I can deliver or what I give back to you. So having photographs of basically kind of the size and the proportion that you're interested in is really helpful to me to give you what you're looking for. And occasionally we'll have patients that come in that are so frustrated, they'll say, well, just make me as small as you can. And at the same time, I don't know that anybody really wants to come out looking like a boy necessarily. And of course we want to remove enough that you feel that it was really worthwhile. And so having those wish photographs is really a helpful guide to me. And when we talk about the scars themselves, some people call them the anchor scars, but they go around the areola. There's a vertical component and one that goes along the natural crease. So the length of the scars may seem like a lot, but those are really great places to hide scars. So there's that natural color change between the areola and the breast skin anyway. So that's a really great place to hide a scar. I mean, you will have one, but there is that natural color change. The vertical scar really isn't very long in terms of how much you see of it, and you already have a natural crease under the breast, and the shadow of the breast tends to hide that scar well. So despite the scars, I would say, being on the long side, they really tend to hide pretty well. And I would also say many patients come in and really